Well, Kate Chaney is the federal independent MP for Curtin in Western Australia. She joined us earlier from our Perth studios. Kate Chaney, welcome back to Afternoon Briefing. Let's start broad brush because some people might not actually understand what this issue we're discussing is all about. What are the concerns in this sector around access to voluntary assisted dying advice and services via telehealth?
Well, every state has passed voluntary assisted dying legislation or is about to, but there is this provision in the federal criminal code that says you can't incite suicide using a carriage service. So that means that, and the federal court found yesterday that talking about voluntary assisted dying technically comes within the definition of inciting suicide. So it means that doctors are actually at risk of prosecution if they use telehealth to make voluntary assisted dying services available to people.
So is this something like, novelty is the wrong word to use, but something of a quirk of the way in which the nation's criminal legislation works, that it is out of step, out of touch with what all of the states and territories have now agreed is an important part of public health services?
I think it's a quirk. It's a piece of legislation that was passed in 1995 to stop people from inciting suicide. Now, we didn't have telehealth then, and since then we have decided that voluntary assisted dying is something that should be available. We've seen great leaps and bounds in terms of access to health services through telehealth for people in regional and remote areas, and it really makes no sense for us to be saying that that doctors can provide voluntary assisted dying services, but that telehealth can't be used. It just means that it's not equitable access for people who are not conveniently located near a doctor who currently delivers these services.
Given how serious and sensitive the issue of voluntary assisted dying is there an argument that it should have some restrictions placed around it in terms of who can access it via telehealth?
It does have a lot of restrictions placed around it, and the process differs slightly from state to state, but there are a series of interactions that need to happen between a doctor and a patient. And doctors take this very seriously. Doctors want to be able to deliver this in compassionate circumstances, but what we're seeing now is that either doctors risk prosecution and travel long distances to have face-to-face appointments, or patients are having to travel those long distances when they're in frail condition, very, very sick and vulnerable, and usually in a lot of pain as well. And at the moment, you can't have any discussion about any aspect of that voluntary assisted dying via telehealth now that we've had this federal court decision. So you can't even talk about whether you're going to be present there when the medication's taken or anything like that. And this just means that doctors have to speak in cryptic terms or else go to these extreme lengths that mean that there isn't equitable access.
So the legislation that you have before the Parliament, your private member's bill, is that looking solely at this issue, or are there some other elements there? Can you walk us through what it's aimed at achieving?
It looks solely at this issue, and that's because a recent conference of voluntary assisted dying professionals found this to be the highest priority in terms of reform in this area, to make it really clear that doctors will not be prosecuted if they are providing access to these services via telehealth. So my bill just makes it clear that voluntary assisted dying is not suicide, and therefore it should be exempted from this particular part of the criminal code. All the states want to see this. Voluntary assisted dying practitioners want to see it. Patients who want to access these services want to see it. And it does seem like a quirk that could be fixed very quickly and simply by the federal government.
I noticed in the Nine newspapers this morning, it seems like some of the state ministers in this space are also coming out and wanting to pressure the federal government on it, Victoria and Queensland in particular. What discussions have you had with the federal government since proposing this legislation?
So I have spoken to the Attorney-General about it, and his position was that the government is considering the issue. I've had doctors from my electorate raise this with me and come and talk to me about the risks that doctors are having to take. And so I will proceed with that private members bill in the new year and really encourage the government to fix this loophole and close this quirk and act in accordance with all of the states, some of whom have actually tried to legislate to prevent this from happening. But the Commonwealth legislation overrides those state pieces of legislation.
You mentioned there that the Attorney-General Mark Dreyfus said he is considering the issue, but you would have also seen some comments this morning from the Prime Minister speaking on Melbourne radio saying that he does not support any changes in this space. Is that disappointing?
It is disappointing. I think it's disappointing for vulnerable people in remote and regional areas and also doctors who are acting with compassion in delivering this service. I do find it, as an independent, the Prime Minister talked about this having been an area of a conscience vote in the past. As an independent, every vote is a conscience vote, and I think that we do want our leaders to act in accordance with their conscience on what they think is right, rather than on a party position. And so I hope that the Prime Minister would open this up to a conscience vote too and allow people to represent their communities in identifying this as a weird quirk that doesn't deliver the will of the people when it comes to accessibility to voluntary assisted dying.
You mentioned that in your discussions with doctors across the country, some of them are taking risks in this space because of this set of circumstances. Can you explain what some of those risks are?
Well, until this federal court decision was handed down, this was considered to be a grey area. So the general view was you're unlikely to be prosecuted, but there is some risk there. Now that risk is really clear. And the reason that federal court action was taken was because a doctor was trying to clear this up to make sure that there wasn't any risk. Now, it came down the other way. I'm hearing about doctors who are travelling long distances, meeting patients who are in pain in car parks to hand over prescriptions or have a 20-minute consultation that they could have done on the phone. Also patients having to drive those long distances as well. Now, this is not covered by Medicare, so doctors are often significantly out of pocket if they're adding travel to the weight of delivering care in this really sensitive and difficult area. So some doctors will take those risks, because their duty to their patient, they think, overrides that risk. But it's a very big thing to ask of our medical practitioners to risk prosecution under the Federal Criminal Code.
Do you have any concerns around some of the health providers out there who are linked to faith-based organisations? So let's use the Catholic Church as an example here. They do run a number of health services across the country, not exactly what you would say keen to support anything that allows greater access to voluntary assisted dying. Have they had anything to say about this issue of opening up telehealth services for this purpose?
So they may well have their views, but I think it's really important that people across the country have choice. Now, they may choose to go to a faith-based health provider, but there should be another choice available to them too, so that they have full access to the services that we as a country have decided should be available to the people of Australia. So that choice is really important, and in areas where we don't have that choice, it just makes telehealth even more important so that people can access this service.
Kate Chaney, thanks for your time.